During the first 2 weeks of life, newborn foal can face several serious medical problems. These conditions need quick attention and care from veterinarian. One major issue is failure of passive transfer. FPT foal are born without strong immunity, so they need to get antibodies from their mothers first milk called colostrum. Within the first few hours, if they don't get enough colostrum, they are more likely to get sick. Another serious condition is septicemia. This is life-threatening infection where bacteria enter the foal's blood, often through the umbilical cord or lungs. It can spread quickly and must be treated right away with antibiotics. There is also something called neonatal maladjustment syndrome, sometimes called dummy foal syndrome. These foal act strongly. They may not stand, suckle, or respond normally. It often happens because the brain didn't get enough oxygen during birth. Other common problems include colic, diarrhea, pneumonia, and joint infection. All of these needs fast medical care, good hygiene, proper nutrition, and making sure the foal gets colostrum or time can help prevent many of these problems. Foal baby horses are very vulnerable in their first 2 weeks. Early detection of illness is critical. Most problems come from weak immunity, infection, and birth trauma. A common problem, failure of passive transfer, cause foal doesn't get enough colostrum, first milk from mare. Importance, colostrum contain antibodies needed to fight infection. Signs, weakness, depression, frequent infection. Diagnosis, blood test, IgG level. Treatment, to give plasma transfusion or colostrum if needed. Septicemia, blood infection caused bacteria entering bloodstream via navel, lungs, and wounds. Signs, fever, weakness, swollen joint, not nursing. Diagnosis, blood culture, white blood cell count. Treatment, intravenous antibiotic, fluid plasma. Neonatal maladjustment syndrome, dummy foal, causes lack of oxygen during birth. Signs, foal is disoriented, doesn't nurse, seems lost. Treatment, supportive care, sometimes squeeze procedure to reset brain signal. Diarrhea causes infection, bacteria, virus, foal heat, hormonal, nutrition, risk, dehydration, weakness. Treatment, fluid electrolyte, antibiotic if infectious. Colic signs, abdominal pain, rolling, not nursing, kicking belly cause, gas, impaction, twisted intestine. Treatment, pain medication, fluid, sometimes surgery. Pneumonia cause bacterial infection, aspiration signs, coughing, fever, nasal discharge, fast breathing. Treatment, antibiotic, oxygen support. Joint or ill-infected navel, septic. Arthritis or omphalitis causes infection spread from umbilical cord to joint. Signs, swollen joint, lameness, fever. Treatment, joint flushing, antibiotic. Prevention, clean birthing area. Monitoring foal closely. Make sure the foal drink colostrum in the first 6 hours. Check umbilical cord and disinfection. Vaccination of the mare before foaling. What is the main source of immunity for newborn foal? Water, hay, colostrum, antibiotic. Which of the following is a sign of septicemia? Bright eyes, fever, swollen joint, long hair, rapid weight gain. Dummy foal syndrome is another name for pneumonia, diarrhea, neonatal maladjustment syndrome, colic. Diarrhea in foal can be caused by too much sleep, hormonal changes, riding dry hay. Shadow the foal, age 1 day old, history, shadow hasn't nursed much, appears weak and sleepy, vital low, IgG in blood, slightly elevated temperature. Diagnosis, failure of passive transfer. Treatment, plasma transfusion, close monitoring. Outcome after plasma and some help, nursing, shadow improved by day 3. Always observe newborn foal closely during the first 48 hours. Early signs like not standing, not nursing, fever should be treated as emergencies. Common life-threatening issues are unusual, preventable with good hygiene and monitoring. Colostrum intake is the most important factor in healthy issue.